Welcome everybody to our webinar on the new patient exam. Just for your information, if you want to ask a question, please type it in to the chat area and then I can answer any questions at the time. So with no further ado, let's talk about the new patient exam. And even though this webinar will be directed more about the orthodontic patient, everything we're going to talk about with regards to this new patient examination is appropriate to any new patient that walks into your practice, whether they're interested in orthodontics or whether they may be interested in cosmetic dentistry, or perio, crown and bridge work, whatever it be. All the information that we're going to discuss tonight is relevant in how to do this new patient examination. So, as we know, the first port of call for any new patient is to phone the practice. And it's really important to train your staff. And you want to train your staff in building excitement and hope to increase case acceptance. And by that I mean, traditionally we've been to a lot of practices and we've seen receptionists do the typical new patient phone call, which would be something like this. Hi, how are you? The patient rings up. They want to make an appointment with Dr. Jones. And the receptionist says, oh, we've got a time at 4 o'clock on next Thursday, and they book the patient in. And that's about it. You're lucky if you get even the contact details. But let's take it to the next level and provide that patient with the wow factor. Okay? So here the patient phones up, the receptionist starts to have a conversation with the patient. So we want to keep it conversational. And we'll ask the patient, how did you hear about us? What are you interested in? And we'll delve a bit deeper, whether it be orthodontics. And let's say it is orthodontics for argument's sake. And so, oh, that's fantastic. Dr. Jones has just taken braces off this young child. It was really crowded to start off with. It was a fantastic result. So you want to use that conversational phone call with the receptionist to the new patient to build up the hope, to build up your credibility, to increase case acceptance. That is really critical, that initial phone call. And then get all the necessary information for the patient, what they're interested in. Are they interested in orthodontics? They might be interested in an implant, whatever it be. But let's say it's orthodontics. You then want the receptionist to emphasise the simplicity of orthodontic treatment and talk about, hey, we've now got accelerated options. We've got aesthetic options. We could do so many different things in a short period of time or provide ideal treatment. Whatever it be, it's really simple now. In our practice, we offer free orthodontic consultations for children, but we don't do it for adults. And I say that only because in our practice, the only thing that we can provide a patient is orthodontic treatment. It may be totally different for you in general dentistry because even an adult who may be a tire kicker from the point of view of orthodontic treatment, they may feel very comfortable in having their perio done, their crowns done. So even if that patient comes in for what would be initially maybe an orthodontic consultation, they may become a good valued client in your practice for all the other aspects of dentistry. So I leave that decision with you. Having said that though, I do have a bit of a philosophy that if a patient refuses to pay your $90 or $120, whatever you want to charge for an initial consultation, they're unlikely also to pay for the full orthodontic fee or an implant. So that's just my philosophy on it. Whereas a child, they're ready to go ahead with treatment 9 times out of 10. And like everything in dentistry, you've got to perform as many of the procedures as possible to get the procedure down pat and improve. No different to you doing implants. You've got to do a lot of implants to get it right. And in order to become more proficient at this new patient examination, you've got to perform as many of these consults as possible and start to improve in your communication skills. And let's help you with that today. You've heard me talk a lot about differentiation, and you must differentiate yourself from other practices. How many times have you been to a doctor or you phoned up for an initial examination with a doctor or even with a lawyer, whatever it be, and they've sent you information prior to your appointment? Very, very few. So what I recommend is prior to that first new patient exam, you send out information to them. And what we send a medical history with the patient information form, so they send it out in the convenience of their own home. How many times have you had patients come in, they turn up late, then they start to fill out their patient history form. Everybody gets stressed because you're now running 10 or 15 minutes late. We also, and I think this is really, really vital, is send them a chief complaint form, or what we call a patient motivation questionnaire, that they fill out, once again, in a relaxed way in their own home. And this will be a really important document for you, as it really comes down to the informed consent of what do they really want, because they'll sign off on it, and gives you a lot of information even prior to their first appointment. And then depending on what they've said to the receptionist as to their interest factor, whether it be orthodontics, and let's say it is, we will send them brochures about SmileFast if you do that approach, or a short-term orthodontic approach, or braces, adult treatment, Invisalign, whatever that patient was interested in. The patient may have been interested in implants, so we'll send them information about implants. Whatever it is, depending on the answers to the questions from that receptionist at that conversational discussion. So that's what we send out to the patient. Now, the question that gets asked of me very often is, do I send this out via email or do I send it out via post? And most people will send it out via email. And I don't have a problem with that. But I will also send it out via post, because once again, this is our differentiation factor. Yes, it's going to cost you a bit more, maybe $10 to send it all out. But what's $10 in the scheme of converting a patient that can be worth thousands of dollars? It's the best return on your investment that you'll get. You'll have your brochures, etc., sitting on their coffee table, so when their friends come, they're going to ask, what's this? And your name gets mentioned time in and time out. It's something different that other people do. It's no different to the stock market. When things are going up, that's when you should be selling. When the price starts to go down, that's when you should be buying. You should be doing the opposite of what the market is telling you to do. That is what we call differentiation. So we send out, as part of that, a cover letter, and we can provide all of this to you. So if you want any of this information, please let us know, and you can modify it yourself. But we send out a cover letter. We send out the patient information form that they fill out with all the details and the medical history, etc. So this is all done prior to their new patient appointment, and obviously they need to bring it in. And this is our general dental patient motivation questionnaire, which we have designed, which is not just for orthodontics, but for everything in dentistry. So we ask them about their teeth. You know, what would they like changed about their teeth? Their shape, their size, their colour, etc. And then we talk about the orthodontic part. If they wish to straighten their teeth, how would they like it straightened? You know, just the upper front teeth, the lower teeth, the back teeth, whether they want to move the midline of the upper to the left or the right, because this will also give us an idea of what are the patient's expectations and will you be able to satisfy them orthodontically. Would they like to change the shape of the upper jaw or the shape of the lower jaw, or do they have other concerns? Really important to know this before the patient comes in to see you. And this is, like I said, an informed consent, because they might say they want to straighten the front teeth, but they've never said anything about fixing the bite. So if that's what their chief complaint is, we can have this now in writing from them. And it's really important. And trust me, it saved me on probably 3 or 4 patients, because I'm sure we've all had that experience. The patients have changed what their chief complaint is as time has gone by. Whereas this is telling us this is what their chief complaint was, and they sign off on it. So we can also talk about the gums. We can also ask them about function, about sleep, etc. Airways, all their problems, and we can then formulate a much better treatment plan for that patient. So this is a really, really important document to have them fill out before their new patient exam. Now, with our Smile Fast approach, which we developed, we've developed a before and after picture book, and we're working on the same thing for you guys in OrthoED, a whole before and after picture book. And as soon as we have that in place, we will provide that to you. But the basics of it is you can develop your own as well. And the before and after picture book, as we know, it's a vital tool because a picture speaks 1,000 words, and we show images of great results. And the nice thing about this is the patients often find a case that looks like their own, and it overcomes the skepticism and objections that usually occur with patients. They don't believe it can be done, and if they see pictures, etc., of other patients, it overcomes this skepticism. And to me, this is a vital tool in case acceptance. Now, how do you utilise this before and after picture book? Well, we don't send it to every patient. That's not part of what we send out. So I will go into how we use it in a minute. But one of the nice things about the before and after picture book, because it's within the practice, and you can actually put testimonials in there. Because where you can't use testimonials is on the web. But now they've come into your practice, they are actually a patient of your practice. And you're not taking this outside of the practice. So you can actually have these testimonials in there. For example, at her initial consult, a new patient requested veneers for a crowd of lower incisors. She had been told treatment would been wearing braces for 2 years. I knew the veneers would ultimately give a poor result, so I showed her the before and after picture book. After 30 seconds, she said, "Wow, you can do this in 6 months. When can we start?" And we show them different pictures. And these are just examples of pictures in our Smile Fast picture book. Crowding with a deep bite that we treated in 6 months. Rotated teeth, we treated in 5 months. This was with Smile Fast. But you can do all of this with OrthoED as well, as you're going to see. How we treated uneven gingival margins, the before and after picture. And the intraoral picture with the before and after, showing how we've evened the gingival margins and then built up the composite on the incisal edges to restore them after we've intruded those over-ruptured upper anterior teeth. Spacing cases, which we treated in 5 months. And patients look at that and go, "My God, my teeth aren't as bad as that." So they feel very confident. Now, the converse may be true. They may say, "Oh, my teeth are much worse." Well, at least you know what you're dealing with. And they may be too difficult for you to treat, but at least we know that beforehand. Or showing just upper treatment only and the issues that you may have with upper treatment. Yes, we can straighten the upper teeth, but we've left this patient with some overjet here. A patient who's a class 3 with worn anterior teeth. And we can explain to them with this photograph how it would be impossible to restore these worn anterior teeth because of the existing occlusal scheme. So by doing orthodontics first and improving the occlusal scheme, you can then go ahead and do your veneers. So these are all aspects that can be shown through the before and after book. High canines and how they can be treated in a very efficient manner. Once again, spacing cases with an anterior open bite, treated in 12 months. Moderate crowding cases, treated in about 15 months with full braces. Severe crowding that required 4 premolar extractions, took 2 years, but showing the patients even the most severe cases can be treated, but it will take far longer and require more orthodontic skills. And included in this before and after book would be the retainers, because you want to give the patient as much information to make an informed decision. Because to me, I only want to treat the patients that I want to treat. So if the patients are too difficult and they're not going to have retainers, etc., they're going to be nightmares. So it's the old question of, let's pick the low-lying fruit. So to show them more information, I would rather the patient back out of treatment early on than go halfway through treatment and be one of those patients that you go, "I wish I never started them." So we talk about the different treatment options in there. with the retainers, with the type of braces they can have, the clear brackets, the metal brackets, etc., etc. So we're going to be developing a whole before and after book that will be even more relevant to OrthoED, but realistically, we probably won't have that done till the end of the year, but we will provide everybody in the OrthoED program with a copy of that generic before and after book. And these are examples of the client testimonials that I talked about. This was, once again, related to SmileFast. With SmileFast, I had braces on for just over 5 months, unlike the 3 years I was originally quoted by dentists for other braces. I'm really pleased with the results. You and your staff have made Make-A-Wish Foundation. I always hated my smile. Having straight white teeth is a dream come true. This changes what other people think. It's the skepticism that people have beforehand. And it's these type of testimonials that break down that skepticism and provide some extra trust to you as a doctor. But how we use the before and after book, we ask the patient to come in 10 to 15 minutes prior to their appointment time. So that's when we give them the before and after book. And if you've got before and after books for your veneers or your cosmetic dentistry or your implants, show them everything. Let those before and after books do your marketing for you. That and the build-up of your reception staff, and then when they walk into the new patient exam and your nurse or your treatment coordinator, whoever's going to be beside you, builds you up as well prior to you walking in the door, means so much more than anything else. So get them to arrive 10 to 15 minutes early and get them to look at your before and after books. Show them how good you are without telling them how good you are. So, the first consultation, you've sent them all the forms, they've filled everything out, they've arrived 15 minutes early, you've shown them the before and after book. So here we are at the first consultation now. They walk into the room, and what are your goals at this initial consultation? And once again, this is designed more for orthodontics, but you can relate to this from the point of view of every aspect of dentistry. So you want to discuss the orthodontic issues, whether they're functional problems or just aesthetic problems. I think that's very important. Everybody's got a functional problem to some degree. You want to overview the treatment goals. You know, what are you going to try to achieve? Fix up the crowding, fix up the deep bite, whatever it be. You just want to overview the treatment goals. And this part, I think, is really, really vital. You must provide the patient with the ideal treatment option. Okay? So whether it be braces for 2 years, jaw surgery, extractions, whatever it be, you've got to provide the ideal option. And then you provide other options that may be applicable to them. It is not our job to tell the patients what they should have. It's our job to provide the different treatment options and to provide them with the pros and cons of the different options. No different to when you go to an accountant and he can say to you, you could set up a trust account here, you could do this, you could do that, and he will go through the pros and cons. And at the end of the day, it's your decision as to which option you would fit in to your life. And that's the same with the patient. And my philosophy is I want to make sure I do more good than harm. And if I go with an alternative option, those alternative options should be reversible. For example, a patient who might be a class 2, div 2, and they just want their upper anterior teeth aligned, they could be left with overjet. And the ideal treatment option may have been to extract upper first premolars, may have been orthodontic surgery. But with a compromised option, which is let's align the teeth and leave with overjet, they still have to know what the ideal options are, and they still have to know that if they want the ideal options later, they can always have that. So to me, I'm very cognizant of the fact that the other options, the compromised treatment plans, have to be reversible. At this initial consultation, you've got to give them the fees and different payment plans, and we will discuss that. And one of the big issues is you've got to remove their objections. Because when you provide all this information to them, they might have objections. Oh, I've got to think about this. And you've got to remove the objections as much as possible. You have to explain the next steps to get started. If they want to go ahead with treatment, how do we start? Do we need to get the records next? Do we need to book appointments in? Do you need your perio done first? Whatever it be, they need to have a plan of what the next steps are in a very simple fashion. And you also need to explain retention to them, because one of the big areas is people go, I didn't realise I had to wear retainers. I would never have had the treatment done if I had to wear retainers. So it's really important that you give them all the information prior to that. And in our next webinar, which is going to be on diagnostic records, we talk about sending informed consents and all that information to them prior to them even having the records taken, because we want to be as transparent as possible. And obviously, and you know this better than I do, any needed perio work or restorative work must be completed prior to starting orthodontic treatment in general. And so you would need to advise them of that and advise them what work needs to be done prior to starting orthodontics. So, to reiterate, we have this general dental patient motivation questionnaire which they would have filled out. So in this new patient exam, we can start to delve deeper into exactly what their concerns are, because we've got it in writing from them. You know, Mrs. Jones, I understand you don't like the shape of your teeth. You say you're self-conscious about your smile. In what way are you self-conscious about your smile? So you delve deeper so you can find out the most important parts to their concerns. Whether you're going to straighten their teeth, and you ask them about move the upper teeth backwards. Are you sure you want to move the other upper teeth backwards? Because that might require extractions to be done. We need to get space to do so. Oh, well, I don't want to do that. But we need to know that before we start, because otherwise, if you try to talk the patient into something that they don't really want, it will come back to bite you. So it's really important we know exactly what they want to achieve, and just to make sure that they filled out that form correctly. So this once again just reiterates that basic motivation questionnaire. At that particular point, once you've gone through all that, this is the most important question that you could ever ask. So if the patient's interested in orthodontics and they've been worried about their crooked teeth, the question will be, if you've considered straightening your teeth and improving your smile in the past, what stopped you from going ahead with treatment? This is the most important question, because what you're going to do is discover their key motivation and their hurdle. For example, they might say to you, well, I went to an orthodontist and he talked about taking out 4 teeth, or he talked about doing jaw surgery, or the cost was $10,000. Whatever it be, you're going to discover what their hurdle was in the past and what their motivation is for treatment. But this question is as relevant to every other aspect of dentistry. For example, a patient comes in and they're missing an upper front tooth. So if you've ever considered replacing that upper front tooth in the past, what stopped you from going ahead with treatment? And they might say, the cost. They were talking about a bridge and they were going to cut down teeth. They were talking about an implant. There was insufficient bone for it. But whatever it be, you will then find the answer straight away as to what stopped them from going ahead with treatment. What is their hurdle and what is the motivation behind them now doing it? So why would you want to do it now than before? Oh, I've heard there's better technology. You say, yep, absolutely there is. We've got aesthetic appliances. We've got payment plans with no deposit. We'll go through all that later on. But what we're doing is removing that barrier straight away. Very important, because most patients won't even listen to you until you get rid of what they're really worried about. So this question will make your consultation at least 10 times more effective. So memorize this question and utilize this question in any area of dentistry that would be appropriate. I can't emphasize that enough for you. And what you want to do is impress the patient with your thoroughness in this new patient exam. That's really important, because you have to now develop the trust and the clinical expertise, which you have, but you've got to show that clinical expertise to your patient. So we have a whole orthodontic patient form, and we will run by this with the staff member. So the patient's filled out all this detail, and we will go through, obviously, with them the dental history again, and then we'll talk about the patient's chief concerns, and then we go into our X-roll exam, the nasolabial angle, and I'll go through, and Robin will be next to me. I'll say it's an acute nasolabial angle. We've got a deep sublabial fold, the facial profile's convex, and she'll just read out facial profile, facial angle, etc. Skeletal vertical, skeletal sagittal, whatever it be, and she just ticks the boxes. We do this on a computer system, but you can do this purely on a piece of paper, and we have all these forms for you that we can provide you. In fact, I think we have provided you these forms already, but if you haven't got them for some reason, just email us and we will get them to you, probably in the next couple of weeks. So we go through this whole intraoral exam, but once again, Robin will be saying dentition, and I'll say mixed or permanent, and cross bites, anterior, and we just go through this, and it looks really professional. We have patient after patient saying, God, you've done this for a long time. And I just say, I just read up on it last night. Just basically showing that I'm not very arrogant. And we all know that I am. So the perio assessment, we just go through step by step, but what we're doing is, one, getting all the information, but two, providing a wow factor to the patient. Look who they've come to. This is a really thorough evaluation. And this is just the orthodontic part. And you could do the whole thing same for dentistry, for anything in general dentistry. And then you'd write down your initial thoughts and your treatment goals for that patient. And then later on, once we've got the records, we'll evaluate the records and do a final treatment plan. But at least this will give you the initial thoughts that you can relay to the patient. For example, you might say, hey, I think this is an extraction case. I think this might be extraction case with 4 premolars to be removed, blah, blah, blah. And you might say that to the patient, but you say to the patient, what I need to do is I need to get a full set of records. I need to get photographs. I need to get molds of your teeth and x-rays and do all my measurements. And then I want to come back and provide you with a thorough treatment plan. Step by step. But I need to get more information and what the fee for that is. But on that basis, here are our treatment goals. This is what I think we need to achieve for you. Okay? And on that basis, I think the fee will be approximately this, and we'll go through payment plans, etc., etc. All the things that we started off talking about in this webinar. But focus on their issues, the orthodontic issues of function and aesthetics. That's the main thing patients want to hear. Is it going to worry me functionally in the future? And aesthetically, is it going to get worse? And it always gets worse. And you can tell the patient that. If they don't like it now, it's only going to get worse as time goes on. The functionality, can they bite properly, etc.? Are they wearing down their teeth? Do they have TMJ issues? Whatever it be, you can focus on their issues. And this is the big factor. This is where most of us go wrong. You want to focus on the patient's emotional needs. And we as dentists are too rational. We talk about class 2s, etc., etc., okay? This is why I love to use a treatment coordinator, and especially Robin, because she can talk to these patients on an emotional need. That's what women do much better than us men, and especially us male dentists. Oh, you got a class 2, you got a deep overbite. Women, don't you want your teeth to look better? It'll be easier to clean. You'll have more confidence. So you've got to talk about emotional needs, because that's what they've come in for. Most of the patients have come in for emotional needs. They want their teeth to look better. And the other key factor is trust. So a lot of these orthodontic examinations, especially if you're dealing with existing patients, so a lot of you people are now in the process of starting your orthodontic journey in your practice, but you've got a great deal of trust built with your existing patients. Utilise that trust to your advantage. When the patient comes to see me, Jeff Hall, they don't have the trust in me unless the dentist has built that trust. And they've said, Jeff Hall's the best. If you as the dentist has given 5 different cards to Jeff or to the patient, 5 different orthodontists, there's no trust there. They think everybody's the same. You know, it's like me saying to you, Dr. Smith, you're the same as Dr. Jones down the road. You jump up and down about that. Orthodontists aren't the same either. Dentists aren't the same. So build the trust. And if you have the trust with the patient, then it's much easier for you to start discussing these orthodontic parts. You can say, I've just been doing an orthodontic course. I think you would be a fantastic candidate for it. Oh yeah, let's talk about that. I've always been worried about it. So all the studies have shown that emotional content is twice as effective as rational content. You can be as rational as you want, but that won't deliver an effective outcome with a patient conversion compared to looking at the emotional side. And this is why I like to use a treatment coordinator. I come in to do the technical part and I leave all the emotional discussion and all the fee discussion for that matter to the treatment coordinator. I never discuss fees, as I will explain to you later. I want to divest myself from anything to do with fees. I'm just the professional person looking after you as a patient in the best possible way. So, to improve the effectiveness of these consultations, you need to ask emotionally loaded questions and build rapport. For example, are you self-conscious when you smile? And if so, why? Oh, because my teeth are dark, or they're wrongly shaped, or they can't, whatever it be, you want to find out why. And they'll tell you they are self-conscious. Well, we can improve that. We can do that very simply. Remember, simple, painless, quick. They're emotionally charged words, and that's what we need to use, emotionally charged words. Do you feel uncomfortable smiling when you're talking up close with someone? Do you hide your smile in photos? And why? And most people do. Do you think straighter teeth will improve your confidence or self-esteem? 99% of people will say yes to that question. And it's no different to anything else. Why do you think women get their hair done? Why do you think they put makeup on? They want to improve their confidence and self-esteem because they want to look better. How do you think you will feel after treatment? Especially the patients who have been worried about this for a long period of time. They're going to feel great. They've always been wanting to do it, but they thought they were too old. Or they didn't have the money to do it. Or they were going to give the money to their kids for them, and now it's time for them to look after themselves. You'll hear that a lot in the 40-year-old age group. I did it for my children, now I've got money, and I want to just do it for myself. So, to recap, in that new patient exam, after you've done it all, you need to overview the treatment goals. It's really important. You've got to provide the patient or parent with the ideal treatment option, the treatment time, the type of appliances, the benefits of treatment, and also the limitations of treatment. And then you've got to look at the other options that are applicable. And once again, you're going to go through the treatment times, the appliances, the benefits, and the limitations. And you can, as the dentist, or you could leave it to a good treatment coordinator to discuss the retention aspect. Personally, I talk about it very quickly, and I leave it to Robin to then talk more about the retention aspect. And the best advice I have is get out of that exam. And it's interesting, when I first started, I used to spend an hour doing these new patient exams in orthodontics, okay? And I can understand spending more time in general dentistry because you've got more that you can discuss, okay? But the longer I was in there, the more confused I made the patient, and my conversion rate was significantly less. Then I cut back my time to 20 minutes, and I let the treatment coordinator do another 25, 30 minutes. My conversion rate increased significantly. I was my own worst enemy in doing these new patient exams. I overkilled, and I had an orthodontist working with me once, and the same thing happened. She overkilled. She made it too complicated. You've got to push the simplicity of everything. And Pretend you're a patient. You've gone to the dentist. What do you want? You want to know what's in it for you. What will I look like after treatment? Is that result good enough for me to live with? What will I look like with treatment? Whether I have Invisalign or I have braces, how will it look? Will it hurt? How do I know it's money well spent before I start? Is it a fixed price? These are some of the questions patients ask, but the bottom line to all this is, what's in it for them? And that's what you need to focus on in this new patient exam. What's in it for them? Is it going to be worth the 6 months, 12 months, the 2 years of treatment, the cost? Is it going to be worth it for them? And this comes back to that patient basic motivation questionnaire and what stopped them from doing treatment in the past. They're the questions that's going to allow you to know what's in it for them. Now, there are other great courses around on explaining treatment options. Mark Hassett has a fantastic course that Robert and I went to of how to explain treatment options, not just in orthodontics, but in every part of dentistry. Do you do a bridge? Do you do an implant? And how he explains it is really, really good. I really recommend his one-day course. And Jesse Green, I think he's a superb communicator, just a brilliant communicator. So if you want people to learn from in how to explain different treatment options, they're the two that I would recommend very highly. Mark Hassett and Jesse Green. And remember, a picture tells 1,000 words. So show a range of the orthodontic before and after pictures. And then you focus on pictures which show a similar condition to the patient. So in that new patient exam, remember they've seen the before and after book in the waiting room. Then you would follow that up either on your computer, whatever it be, where you focus then on pictures showing a similar condition to the patient before and hopefully final photographs afterwards. And that can be for implants, for perio, whatever it be. And you comment on how much change has happened in such a short period of time. And try to highlight a few of those strong patient testimonials that will really reassure the patients. So, I use a treatment coordinator. I recommend that very highly. Now, you don't need a dedicated one. You can have one of your nurses that can double up as a treatment coordinator, but you need to train them in communication. And once again, once you leave that room, they need to overview those treatment goals that you've told the patient. So they've got to reiterate and reinforce what you have said. They've also got to build you up. You know, Dr. Hall is fantastic. You know, he does my family. You know, Dr. Jones is just brilliant. You know, we've just had patients come in the last few days and they've raved about it. They've brought in presents for him. So the build-up should come from the treatment coordinator or the assistant in the room. They need to reiterate the ideal treatment option. They need to reiterate the other options because remember, patients only remember probably 25% of what you tell them. And we're no different, I might add. And as we get older, we probably remember less and less. So they reiterate everything that you have already spoken about. But they are responsible purely for doing the fees and the payment plans, hopefully removing objections. They reinforce the retention part for me. They will go through in detail the next steps to get started, whether it's a records, it's a conference appointment, or going straight into braces, or whatever it be in dentistry. They can book their appointments as necessary or follow up a call. And then we're going to talk about SNAP. And the patients, we get our treatment coordinator to take a photo of the patient with a full smile. And we'll talk about that in 1 second. So, we provide our treatment coordinators with a PowerPoint presentation, which is a generic one, and we can provide this to you, but we're also developing PowerPoint presentations for all the various aspects of orthodontics. For example, if the patient needs a Herbst appliance, if the patient needs an RPE, early treatment. So we'll have separate PowerPoints as time goes on that the treatment coordinator can just go straight through. And that will also have the before and after photos. So as we build these PowerPoint presentations for ourselves, we can give those to you for your treatment coordinator. So this is just an example of a fairly generic PowerPoint for the treatment coordinator. So this one shows about SmileFast braces and compares it to Invisalign, and we obviously do both in our practice. We also show them about conventional braces and self-ligation braces, etc., etc. So this is what the treatment coordinator would run through. We can go through Invisalign and we can show them how Invisalign looks, how it's clear, how it goes into the patient's mouth, and you can hardly see it. But we'll also talk about the pros and cons of Invisalign as well, because we have to give them the correct options. So we talk about Invisalign as well. We talk about bite turbos if we're going to use bite turbos and show them what they are, because I want to tell them as much information as possible, because I don't want to be doing this and they go, I was never told. So we show them about bite turbos. We show them about retainers again, about fixed bonded retainers, removable retainers, when we would use them for their particular problems. So this is just a very generic treatment coordinator PowerPoint that we can provide you, and you can modify it as you see fit. But we will be doing PowerPoints for different types of issues, such as deep bites, open bites, etc. And as we do that, we're going to provide all that for you. One of the most important things is the payment plan. And one reason why orthodontists have been successful over many, many years is we've been offering payment options. And it's only probably, I think, in the last 5 to 10 years that general dentists have started to understand that, because patients can't afford treatment. So in our practice, we offer a 5% discount if they pay in full. Some people offer 7%, some people offer 10%. You decide what is it worth for you to get your money up front. We find most patients do that just prior to the end of the financial year. Or we use DentiCare with some initial deposit, and we've got National Dental Plan that will pay you up front. Or you could do an in-house payment arrangement, but to be honest, that's what we did 15, 20 years ago. We now outsource our payment plans for a variety of reasons. And one of the main reasons I like to outsource it is I want to dissociate myself and our orthodontic treatment with payment. I don't want them thinking they're coming in every 4 weeks or whatever it be, and there's a fee associated with that. If they've only been in the chair for 2 minutes and they get charged $300, $400, whatever it be. I don't want us to stop treatment for a patient because they can't pay. Let somebody else have that problem and sort that out, because it's a terrible goodwill factor if you start to have these confrontations with patients. But you need today flexible payment arrangements to convert patients. And when I do the live webinar, when I do our live lecture, I go to the audience and say, how many of you own your own car and paid cash for it? Or do you lease your car? And 90% of the audience will lease their car. Why? Because they need a flexible payment term. And we are the high-end earners. So can you imagine somebody who is earning their $50,000 a year, and they're paying their rent, they're paying food, etc. They don't want to put $5,000 or $6,000 on their credit card because they max it out. So you need flexible payment arrangements to convert patients. And that's no different whether you're talking orthodontics or you're talking general dentistry, crown and bridge, etc. And my advice is you use these flexible payment terms for everything. Your conversion rate will increase significantly. You probably have so much in the way of crown and bridge which is waiting to happen because they can't afford it. And I can guarantee if you start to advertise and say, we'll do no interest, payment plans over 12 months, you'll probably get all these patients from your colleagues that have held back their treatment because they can't afford it. So have a think about it, because you need to open your mind a little bit and look at different ways to bring patients and provide them with better customer service. So flexible payment arrangements are essential nowadays. So DentiCare. acts as your clinic's payment plan administrator. And basically, it's an interest-free payment option. There's no credit contracts. There's no credit checks, which is fantastic. It's not a finance option. So there's no interest involved here at all. It's a simple one-page form they fill out weekly, fortnightly, or monthly repayments. The good thing is it's guaranteed payment to the clinic, but only on the basis of what the patients have contracted to pay you on a monthly basis. So, for example, if they've contracted to pay you $300 a month, you will get your $300 a month from Denticare, even if they don't collect. But you don't get your payment all up front. It's over a period of time. So it depends on your cash flow, etc. There's no GST, so it's easier accounting. You don't have to send out any receipts or statements. And Denticare Office handles all the payment queries. So this can be fantastic for you. Okay? And it's guaranteed payment to the clinic. That's what I like about it. So one of our clients has just said that I obviously put them onto Denticare previously in one of my lectures, and they said it was a great find. And it is. It's fantastic. But I'm also going to give you some other options as well. So this is the sample direct request form. It's a simple one-page form. The only thing, they have to be over 18 and they've got to be, I think they have to be employed. Okay, and they've got to be an Australian citizen. So it's really very, very easy because there's not a credit check per se. And it really can't be simpler. Like I said, Denticare handles all payment plan administration, and all you do as a clinic, you forward the form to Denticare's head office. That's it. And then you get paid monthly, etc., whatever that patient is going to be paying you. And Denticare, once again, to reiterate, guarantees the full payment, but you only receive the payment as per the negotiated payment plan. So this can be a cash flow issue for you at times. So you can do a variation. You might ask the patient for a deposit of $1,200, covers your lab fees, etc. Yep. So Jess has just asked me which company has no deposit. Denticare needs 20% up front, I think. Okay, and I agree with you, Jess, that this is an issue with the percentage. So let me talk about different ones. So Denticare is 1300 633 472. David Cathy is the CEO of Denticare. So National Dental Plan by Certegy. Now it's interesting. They've got an option. I think it's called Hum. They just released it recently. And here in this slide, it says patients need to pay a 20% deposit. They've just released a new product, like I said, called Hum, and it's actually a zero deposit. So this has only just happened in the last 4 weeks, so that'll answer one of your questions, Jess. That's probably the best one from a zero deposit, okay? And you get all your payment up front. Obviously, you're going to have to pay a percentage fee for it for doing so, but you get all your money up front. And the patient's in, and your percentage fee will vary depending on whether the patient pays it over 6 months, 12 months, 18 months, or 2 years. So you pay a higher percentage, and I'll give you the contact details of Adam Veron in a minute, and you can speak to him about it. So Certegy is the one that we're going to be using a lot more as well, but we also use Denticare as well, okay? Because patients just Denticare is probably the easiest sign-up procedure out of all of these people. So Certegy's National Dental Plan, it pays you up front, okay, up to $9,000. And these slides are a little bit old because this was about 18 months ago, okay? But now, as I said, they've got the Hum product. One of the other great benefits, so they tell me, and I haven't seen this myself, but if you're a repeat customer with this Certegy product, because this Certegy product is not just involved in dentistry, it's involved with Harvey Norman, etc., there are things called VIP customers. And so they can market your practice to VIP customers. So a VIP customer is anybody who's taken out a loan previously and hasn't defaulted. And from what I understand, and you don't quote me on this, but a VIP customer doesn't have any deposit anyway. So they never had the deposit in the past, okay? But the new scheme, which has just been released in the last 4 to 6 weeks has no deposit. And Jess, you can speak to Andrew. He knows all about this, by the way. So it's better for your patients. There's no interest, low patient fees. Once again, the patient has to be over 18 years of age, full-time employed or self-employed, and they're going to be employed for 30 hours a week, which is a lot for a lot of these patients. Have a bank account or credit card in their name. So that's each one of them has their own little idiosyncrasy. But they claim it's a simple 3-step process. We didn't find it as simple, but once again, this was going back 18 months to 2 years ago, and all these things are improving. But I think if you want an interest-free, no deposit option, then this may be the way to go. And you get your money up front. But remember, you're going to lose, I think it's 8%, 9%. Can't remember exactly the percentages, but they will let you know. But the VIP program is what really interested me, because I think as time goes on, this could be a whole marketing area for your practice. Yeah, these VIP people will come into your practice because it's faster, the application process is easier, there's lower, or actually now there'll be no deposit required. So these are already patients who understand this financing plan, and they can actively promote your practice. So I like this. Contact Adam Veron at National Dental Plan, and his number is 0424 185 669. That's probably the best number because that's his direct mobile, or 1300 300 737, and tell Adam that you're a client of ours, okay? And he will look after you as much as he can. Then we've got Zip Money, which is a no deposit option again, all money up front, and once again, the percentage you lose depends on the amounts and payment loans and the loan to the patient. But in our experience, and we've been doing this for about 12 months, I thought this was going to be the best thing ever. We find it difficult to obtain finance approval with this particular company. And that becomes a real problem. And this goes back to the days of GE finance. If you don't get finance approval, the patients then feel very embarrassed and they won't even come back to see you. So unless they're going to be approving cases, and that's what I like about Dentacare so much, and I like about National Dental Plan. So we are actually moving away a little bit from Zip Money, unfortunately. Okay. So you just asked the question, do patients have to claim back their health fund rebate on their own? I would imagine they would, because the money's not going into your account directly. So I would imagine they would, but I think you need to ask that question directly to Dentacare. And I'm sure that David Cathy will have the answer right there. So SNAP. We used to use SNAP a lot. Okay. The way we use SNAP now, and let's show you what SNAP is, and then let's explain how do we use SNAP in our practice, okay? So we find it increases our cosmetic bookings immediately. And you can see it's a simulation process. So you take a picture and you can simulate what the patient's going to look like with crowns and veneers, whitening procedures, closing diastemas, bridges, implants, perio, etc., etc. It's not a treatment plan. It's used purely to give the patient an idea of what they could look like if they had cosmetic dentistry. And each photograph has a printed disclaimer. So you have the photograph and there's a printed disclaimer. So you've got the before and after, because the one thing which is so powerful is the patient seeing it in their own face. You can put teeth on a model, all that type of stuff, but when they see it in their own face, that's when they get sold on it. So yeah, imagine this patient comes in missing a front tooth and you've simulated putting back the front tooth. He's booked in straight away for an implant because now he knows what's in it for him. He can see it straight away. Yeah, snap-on teeth. Yeah, the benefits of SNAP. You get an instant return on your investment. You get great patient acceptance. It increases patient confidence. This photograph is produced in 4 minutes. It's really wonderful and it's easy to use. Anybody can use it. How do we use it? Well, do you remember I said the treatment coordinator will take a photograph of the patient? So I tend to use it. The hardest part I find is, let's say the patients walk out of the practice and they're still thinking about it. How do you try and reconvert them, get them back into your system. What, your treatment coordinator or receptionist phones them and says, hey, are you interested in treatment? No, I'm still thinking about it. Okay, bye-bye. It's very hard to get them back. So we take that photo and then we'll do the simulation for those patients who are undecided or may have cancelled their records appointment. And we say, look, Dr. Hall's done this simulation. We think it looks fantastic. Would you like to come back and discuss how it was done and how long it would take, etc.? So it gives you that another opportunity where you're providing them with something. Also, you could do it on the day, but I don't like doing anything on the day. I want the patients to feel like I've put in a lot of work. So even though it takes me 3 or 4 minutes, I want to send it out to them in a week's time. And then you do a follow-up phone call afterwards. So that's how we use it. You could use this as a way of driving patients in. We're going to give you a free simulation. So you've got a special offer. Rather than a discount, give them a free simulation of what they're going to look like. Value of $500. Who can tell what the value is? You can just put any perceived value on you want. So it could be used as a great marketing tool. Whenever we do a report to the patient, we never give that report to the patient then and there, even though it's straight word processed off our computer. We will send it out 2 days' time. Once again, for the patient to have that perception, Jeff Hall did a lot of work. He put together this big report. We've just copied and pasted standard paragraphs. But I want them to feel that we've done a lot of work. So it could be a marketing ploy to stimulate new patients, and we've got clients who've done that, and we've done it in the past, and it's fantastic because the perceived value. We can reactivate patients who are pending, and that's how I really like to use it. So here is a video of how we did a new patient exam with my previous treatment coordinator, Paula. So I'm not going to go through that now, but we will give you access to it because it's about 15 minutes and it's getting a bit late. But it would be really good to see how did we do a new patient exam. So we will provide you with a link to that new patient webinar. So to reiterate, at that initial consultation, we want to discuss the orthodontic issues, function and aesthetics, and that would be no different to any general dental problem, function and aesthetics. We want to overview the treatment goals. You've got to provide the patient with the ideal option, other compromised options that are applicable and hopefully reversible, discussion of fees and payment plans, removing those objections, the next steps to get started. What are they? The retention aspect in orthodontics, and obviously before you do any orthodontics, any needed perio or restorative work must be completed prior to orthodontics. The 5 steps for a patient to say yes. Discover and reflect back on the patient's emotional needs. The basic motivation questionnaire, the emotional questions that you ask them. Use SNAP or other aesthetic simulators to showcase the patient's potential new smile. Show pictures of great patient results to build proof. Walk them through the steps, the visits, the time frame, the process, and uncover and negate the hidden resistance. And most of it is money, which now with payment plans I think we can negate. And will it work? And that's your confidence. And at the end of the day, give them a mirror and ask if they want to live with that smile or bite. Because they really don't, or they wouldn't have come in to see you. They've made the effort to come in and see you. So that it does concern them. So, we will provide you with those resources of the new patient exam form, the patient basic motivation questionnaire, etc., etc. So, we've developed a financial spreadsheet, and this is, if it opens, which it may not. And if it doesn't, Adam's just trying to sort this out for me right now. Okay, so this says a lot, but what it's all I'm trying to make the point here is that down the track, if you want to be really profitable in orthodontics, you need to delegate a lot of your procedures to a hygienist or therapist. And that's what this spreadsheet, which we can go through at a later time, is demonstrating. We want to delegate as much to the hygienist as possible. And all you should be doing is what I do, is be a demonstrator. And it's your knowledge which is the key. But the new patient exam is all you as part the treatment coordinator or the assistant. Once you get out of that and we go into the record stage and we go into the bonding, etc., in orthodontics, we can delegate 95% of that to the hygienist. And my advice is to start to think about, and we are happy to help you, how to integrate orthodontics into your practice, and we'll do a webinar on that at some later stage, but how to do it in a profitable and predictable manner. And the hygienist or your auxiliary staff is key to that. And if I get out of this. Okay. So that concludes our webinar for tonight on the new patient examination. I hope it gives you some pertinent tips that may help you in your practice, not only in orthodontics, but also in all areas of general dentistry. Because I think some of the parts that we talked about can really increase your conversion rate. And I'm a really big believer that most of you don't need any more new patients. You just have to convert the ones you're seeing. If you can convert an extra, let's say you're seeing 10 new patients a week, and you can convert, you may be converting 5 of those now. If you can convert an extra 2, you've increased your practice by 40%. I mean, the figures are really quite ridiculous. You need to spend more time in converting these patients because the cost of acquisition of a patient is enormous, whether it be marketing, whatever you do. So if you've got the new patients coming in, we have to just hone in and teach you skills to convert them better. So on that note, we've gone an hour. I hope you found the webinar to be useful. We have recorded this so that we're going to put this online and we can provide you with a link to that. We can provide you with any information that you want. So whatever you would like, email me, jeff@orthoed.com.au, and in the next couple of weeks we can provide anything you want. So thank you very much for your time. Happy to answer a few more questions for you if you want. Otherwise, we'll see most of you at one of the other modules. Jess, that was my pleasure. I hope you enjoyed it, got something out of it. Benita, I hope you enjoyed it too. Apart from some very nice positive comments and thank yous, I think that probably does it for tonight. Thank you very much for your time. Good night.